My name is Dr. James Broussard. In this video, I'll be providing you with an introduction to the Brief Digital Accelerator treatment for gambling, also known as the BDAT. The BDAT uses a digital scratch-off vending machine that can be played at an accelerated rate while observing information on the outcomes. These digital gambling simulations are used to teach gamblers about concepts such as probabilities, odds, and the rate of return. The BDAT process contains 3 steps. First, you'll complete a brief assessment with the client. Next, you'll complete 1 or more exercises using the Digital Gambling Accelerator program. Finally, you'll engage in goal setting and resources review for those clients that choose to make changes to their gambling. Let me introduce you to the Clinician's Guide and Resources Workbook, which you can obtain from the Veterans Affairs South Central MyRec website. Let's take a look. The Clinician's Guide and Resources Workbook contains 3 sections which will help prepare you to deliver the BDAT to clients and patients in 1 or more structured treatment sessions. In Section 1, the Introduction and Overview section, we discuss necessary clinician experience, guide organization, the BDAT approach, research outcomes, and also provide some recommendations for using the BDAT alongside other prevention and treatment approaches for problem gambling. It is important to review this information in this section before attempting to administer the BDAT. The BDAT approach is grounded in several theoretical models and uses elements of multiple treatment approaches to improve decision-making, increase motivation to change, and also reduce urges to gamble. These theories and approaches include cognitive therapy, experiential learning theory, and the use of motivational interviewing principles as well as cognitive debiasing strategies. However, detailed knowledge of these different approaches is not necessary to administer the BDAT. Any clinician with competencies to deliver psychoeducation on topics such as health behaviors and addictive disorders should be able to provide the BDAT to clients. However, we do recommend a thorough review of the information contained in this guide and a general review of the recommended reading materials first, unless you're already familiar with these approaches. In Section 2 of this guide, we provide the BDAT session overview, which is separated into 3 steps. During Step 1, the clinician develops rapport with the client and obtains basic information about the client's gambling. This will include developing an understanding of the client's preferred gambling behaviors, how much they spend on gambling, and the degree to which the client displays signs of problem gambling. You will also complete a pre-session rating form with the client to collect ratings of their belief in the chances of winning, readiness to change, urge to gamble, and other important information. Following this, in Step 2, the clinician will help the client complete a tutorial followed by 1 or more exercises using the Digital Gambling Accelerator. Each of these exercises contains a general description along with steps for completing the exercise, then a follow-up discussion, and finally an extra credit section which can be completed during the session or in later sessions. I'll now demonstrate the first 2 exercises in the guide. What you are now seeing is the digital vendor interface. It contains several different icons and displays. There are 10 different digital scratch-off tickets to choose from, with different costs and odds for each. You can see the odds and prizes for each ticket on a different tab. The tickets generated by the Gambling Accelerator use odds taken from real scratch-off tickets, and they are generated using a random process similar to the one used by game designers. For Exercise 1, we'll play through 20 digital scratch-off tickets. To enter play money, I click on one of the 2 insert icons. In this exercise, we ask clients to enter their daily or monthly average amount spent on gambling. After this, we select the ticket we want and then play through 20 tickets one at a time while observing the outcomes. You can see that the total cash tracker shows a line graph that tracks wins and losses as you play, allowing you to see the overall trend in money spent on gambling. On the overview chart, you can see a list of outcomes for each ticket, which is color-coded for wins and for losses. This chart also shows overall if you have won or lost money since the beginning of play. This too is color-coded, white for being up and red for being down. Exercise 1 shows what can happen in the short run while gambling. However, in Exercise 2, we show off the accelerated play feature of the digital gambling accelerator. After entering a bit more play money into the vendor interface, we play through several months of digital scratch-off tickets using the Play 20 button. You can also view the last bet tracker and overview chart. The last bet tracker displays a summary of the outcomes of each batch of 20 tickets. As you can see, the trend of win and losses over many bets has a negative pattern to it. This is known as the negative rate of return, which is based on another concept, the house advantage. This allows clients to observe thousands of gambling outcomes in minutes, showing them the true long-term impact of their behavior. These exercises and others can be repeated several times to learn more. Further discussion and exercises help to reinforce these lessons so that clients can begin to understand the true nature of the chances of winning on games of chance. Once these debiasing exercises are completed, in Step 3, the clinician will administer a post-session rating form and will then review with the client what was learned during the session. Afterwards, clients are asked if they would like to set a goal to make changes to their gambling behavior, or if they would like to be referred for formal diagnostic assessment or treatment services, should they be appropriate. Clients that decide they would like to make a change to their gambling can also complete a SMART Goals worksheet and obtain information about additional resources which are contained in the guide. Finally, in Section 3 of the guide, we describe the structure of future sessions should the client choose to continue to learn more about their gambling by participating in BDAT booster sessions. This guide also contains appendices, including provider and client handouts, a frequently asked questions list, and a guide for installing the digital gambling accelerator on a PC. I hope you've enjoyed watching this introductory video on the brief digital accelerator treatment for gambling. Perhaps you'll consider using this approach with your own clients or patients that display signs of problem gambling. Our hope is that the BDAT can assist clients to make healthy and informed decisions about their gambling and, if necessary, make changes if they are having problems. As we continue to build on the BDAT approach, please check back for additional instructional videos and program updates. Thank you and best of luck.